young while hurting the poor and the old.
Few people understand health care more than the doctors who see how it affects the patients that they deal with on a daily basis.
Martin Savage spoke with 3 physicians about what they think about Obamacare and this new plan to replace it. Here it is.
Kitsap County, Washington State, an hour's drive west of Seattle. Like anywhere in America, a place where people need health care and a way to pay for it. Kristen Gunnerberg is a surgeon, Peter Lehman, a primary care physician, and Nuran Elajba, a pediatrician. Different doctors, different politics.
I voted for Gary Johnson,
The Libertarian
candidate.
I voted for Donald Trump. I
voted for Hillary Clinton.
You might think there's little they agree on. Wrong. They all believe the current healthcare system is unsustainable.
Can I say it's broken?
Yeah, I know.
I say it's unequivocally broken.
Yeah.
Ask any patient.
Yeah.
Do they think it's a system that serves their needs and that they're happy with?
Under programs dominated by health insurers, they say doctors are stressed to see more and more patients to make ends meet. Patients are frustrated because they can't get an appointment to see a doctor, and when they finally do, only get a few minutes. It's all about numbers.
We're kind of looking the wrong direction, I think. We need to be looking at how do we provide quality care for patients without driving up price.
That's the Democrat doctor criticizing Obamacare, and the Trump doctor says the new GOP plan is just as bad and will cover fewer people.
Yes. Well, I don't think it's better. I think we're probably on the wrong track.
Dr. Elajba even told Trump that in a letter she posted online, begging, please go back to the drawing board and start again. The problem, they say, is not all the talk about which party's healthcare plan is better. It's that Washington's having the wrong conversation.
We're spending too much time talking about how do we cover people with insurance, rather than what?
Rather than talking with patients about the price for care and what is the real cost.
The skyrocketing cost of everything in healthcare, they say, is what makes it unaffordable and thereby inaccessible. And because they daily battle with cost versus care, doctors have a lot of good ideas on how to fix things. Except whenever Democrats or Republicans discuss healthcare reform, the doctors say there's always something missing, which they noticed again in a photo of Trump and his team.
There were no physicians.
Why?
Not a one.
What about the doctor Trump appointed Secretary of Health?
Really a remarkable
Tom Price, they say, has for a long time been more politician than physician.
Why wouldn't we come to you? I mean, you all are on the front line, so to speak.
Front-line practicing physicians have a long history of not necessarily being at the table. And I think it's a shame that we haven't been, because if we had been more involved from the beginning, we might be in a different position.
I should probably point out that these doctors don't want to come across as just dumping on health insurers. They believe that health insurance has a role to play. It's just not the whole solution. And they want to be part of the active discussion, because they say maybe more than anybody, they know that whether it's Obamacare or the latest Republican plan, when it comes to health care in America, we just can't keep going the way we're going. Martin Savage, CNN, Bremerton, Washington.